In contrast to other hematologic malignancies, CLL is not necessarily treated when diagnosed first. Early stage patients are being observed only until they develop a symptomatic disease progression. And this concept is based on the clinical Ray and Binet staging system. And nevertheless, there have been several attempts already to combine an early treatment in selected high-risk early stage patients, but all of them fail to improve survival, so observation remains the standard of care for those patients. And in this CLL12 trial, again, we try to combine an early treatment in selected high-risk patients with the aim to improve survival for this patient subgroup. And in this trial, we use the CLL score as a risk stratificator. And this score identifies 8 different prognostic markers that are all of them are differently weighted, and they sum up into one single risk score. And this risk score differs quite beautifully in terms of survival independent of clinical stage. So you also have BNA patients that do have different risk groups in terms of survival. And in the CLL12 trial, we used this risk score as a risk stratificator, and the patients with an elevated risk of disease progression and an impaired survival are allocated to the treatment arm to receive either Ibrutinib or placebo. And the aim of this trial is not only to delay the time to first chemoimmunotherapy, because Ibrutinib is a novel agent and we call it a chemo-free agent, but we also want to improve survival for those selected high-risk patients.